Are you a Bharatanatyam dancer having knee pain? Do you want to maintain and improve the health of your knees? Are you concerned about having early arthritis that is experienced by a lot of dancers? Then do sign up for the Healthy Knee Program. This is an 8-week self-paced program created by physical therapists specializing in dance. It includes education on anatomy and physiology of the knee, common injuries in the knee sustained by dancers, and basic routines including stretching, strengthening, agility, and balance. Here's a small snippet of the program, and if this piques your interest, make sure to sign up.
The knee joint is a remarkable structure that allows for essential movements like walking, running, jumping, and of course, dancing. Now, at the base or the core of the knee joint are the bones that make up the joint. Before we delve into the specifics of the bones, let's talk about the skeletal system overall. The skeletal system is all the bones of our body, and its importance is that it provides us that structure or that basic framework and gives our body the shape. If it wasn't for bones, we'd just be a pile of muscles, and it's not very efficient for movement. And a joint is where bones come together, and that area is where movement is allowed. If you can think about your forearm, for example, you can't just move your forearm at any place, right? You can only move it at the wrist and at your elbow. So the wrist and elbow are joints, just like the knee is a joint where movement is allowed. Now let's get into the different bones. I have a red laser pointer here. If you guys can follow that along, you'll see what I'm kind of talking about and pointing to. So we have the upper portion of our knee joint is made up of the femur, which is the longest bone in our body, connecting the hip to the knee. Then we have our tibia, which is the bigger bone of our lower leg, connecting our ankle to our knee. That makes up the lower portion of the knee joint. And then we also have the patella, which is also known as the kneecap, and that sits in front of both of those bones. Over here to the side of our lower leg, we also have the fibula, which is a smaller bone of our lower leg. And it doesn't directly impact, or it isn't directly a part of the knee joint, but it does impact it indirectly because there's a certain ligament that's attached to it that affects the knee. So we'll talk about that a little bit later. So again, the bones or the three bones that make up the knee joint are the femur, the tibia, and the patella. Begin sitting at the edge of your chair in an upright position with one leg out straight in front of you. Hinge at the hip and bend your upper body forward until you feel a stretch at the back of your thigh, stretching the hamstrings. Hold this position for the length of the stretch, and when you're done, return to the starting position. We're going to foam roll our adductor muscles along our inner thigh. You can begin by laying on the floor and stretching out one leg with your elbows on the ground to support yourself. Place the foam roller underneath your inner thigh and gently roll back and forth. You can adjust the foam roller as necessary. Make sure that you don't go below your knees. And when you're done, you can return to the starting position.